Hi there, this is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is going to be a little different from most of the ones that I've done. It's called the crystal ball and aphasia, or we could just turn that around and say aphasia and crystal ball reading. Well, you may be wondering what this is about. Well, it's about crystal ball readers who, back in the day and even today, a person goes to them and asks them a question about the future. And the crystal ball reader looks into the crystal ball and makes a statement as to what the future may bring for you. Well, I've never been a proponent of crystal ball readers or spiritualists or things like that. But everybody has their own opinion about them. And what I want to just basically say is that there ain't no crystal ball readers who are going to tell you about what's going to happen with aphasia and how much it's going to recover and what to expect down the line, because it's extremely variable. I mean, I can tell you that I've worked with a number of people who, when they first came in, I never thought we were going to really get anywhere much. And they had the type of caregiver or partner who just didn't want to quit. They were committed. They said that was what they were committed to, and that was to helping their loved ones speak better. So, and then I've seen others who have said, well, we're not going to continue with therapy because the doctor said chances are they're not going to recover. Or, in other cases, I've seen patients who've been to 2 or 3 therapists, and the therapists have said, well, you're not going to talk again, and you might as well just realize that. So these are perfect examples of crystal ball readers. Crystal ball readers are crystal ball readers. They can't predict the future. Nobody can predict the future. But I'll tell you what you can do. You can work like you know what. You can work like heck to accomplish anything that you really want to do in life. And if you're committed and if you have the right people behind you, there's amazing things that happen. I mean, you know that. There are miracles that basically occur with people because they have this disposition of never quitting. They have a disposition that what they're working on, what they want to achieve, they want to achieve it. And there's nothing that's going to get in their way. So, I just want to tell you that the power of an individual's focus and determination and commitment to an idea, I believe, is as good a prognostic factor as anything else. Because, I just don't think that a physician or even a speech pathologist who may not be all that experienced or may not have a whole lot of tools in his or her bag, I just don't think it's fair for anyone to make an assumption that an individual is not going to speak again. I think that can be a conclusion that can be determined after a considerable amount of time attempting therapy and trying to find the best therapist that you possibly can. So another one of the prognostic factors that you don't need a crystal ball for is if you have a team of people who are dedicated to helping your loved one talk, whether it's a spouse or whether it's a family member or even if it's both, and you're all committed to that, and you've learned what to do to help people speak or to help your loved ones speak, and you're on the playing field each and every day doing exactly that, well, guess what? You can't help but get speaking improvement. This is Mark Idelman, speech-language pathologist. This video has been about crystal ball gazing and aphasia. Don't trust it. Just because someone tells you that your loved one can't do it, that doesn't necessarily ring true. It just doesn't. It just doesn't. What really rings true is the level of commitment of the family, of the patient, and of the team of people who are working with your loved one, and especially your loved one too, their commitment and their motivation. And of course, I want to just say that there are some people who will not speak again. I've seen them. I haven't seen too many of them. I've seen very few of them, in fact. I've almost always seen across the board that there is always speaking improvement if there is a commitment to doing that, and you can break down the speech act to the simplest of forms. So this is Mark Idelman, speech-language pathologist. Thanks for stopping by today. And if you like this video, please give us a thumbs up. And if you want to be notified of future videos, please kind of put your finger on the bell, which is somewhere down there. And underneath the video also is a link to our website, and a link to our Facebook, and a link to getting on our mailing list, and a link to a questionnaire. So if you'd like some individual mentoring, or if you'd like some individual guidance or advice regarding a family member, kindly fill out the questionnaire. There's a link down there underneath this video, and just press the title, and that'll open up and describe this video, and in the video there'll be a bunch of links. So you can also hit the questionnaire link, which will take you to a little form that you can fill out, and just tell me about what your challenge is, and I'll get back with you, and we'll arrange some way to help you. Okay, so that's about it for today. It's been wonderful. Thanks for stopping by. Don't forget to like this video and get on our mailing list, and we'll see you soon. Bye-bye now.